I'm here today with Lisa Burchel again from Burchel Therapy Services, and we're going to talk about a subject that seems to be in the news a lot, and that's Parkinson's. And Lisa, I have to admit I don't know near as much about Parkinson's as I probably should, so I'm looking forward to hearing what you have to say and what kind of things you're encountering in the Enid area, even with Parkinson's.
Okay, all right. Well, let's start by saying what Parkinson's is. Parkinson's is a chronic progressive movement disorder that impairs our movement to where we can't move like normally. It starts usually, we'll see a pill rolling tremor. Tremor is the most common. It's usually on one side in a hand usually.
A pill rolling
tremor, and
okay.
It looks just like this,
wow.
you would have a pill up into your fingers, and that's why it gets that name. But you can also have a tremor in your cheek, you can have a tremor in your arm, and you can have a tremor in your leg. That's usually normally how it starts. Some people don't have a tremor. Some people will have severe pain, and they're having pain from like a type of muscle spasm. And so that's sometimes where you can find it. What's interesting about Parkinson's is if you had high blood pressure, we would know that because we would take your blood pressure and we would calculate on several days and it would be high. Same thing if you have diabetes, we would check your blood sugars and see if it's high. Parkinson's is diagnosed by what it's not. So when you start showing up with these symptoms, you would go to a neurologist, and you want to become very good friends, and you want to be a very good historian with your neurologist, because that's what's going to give them the telltale signs. They might do a CT scan or an MRI that rules out possible brain tumors, other problems in the brain. They might do a blood test on you, and when all those tests show that it's not something else, then that's when we diagnose it as Parkinson's. That's when a neurologist would diagnose it as Parkinson's. So
that's really interesting. So you can't just go in and say, "Hey, doc, give me a Parkinson's test."
That's right. That's right.
Wow.
Yes.
And so we're starting to see this more and more in the news. It seems to be on the increase. Is there anything? I mean, the pill rolling and the slight tremors, that would be some indicators that maybe I need to start talking to my regular doctor?
That is. Parkinson's also has a feeling of being very exhausted at times. You get this overpowering feeling of being fatigued. That's a symptom of Parkinson's. Sometimes people have just swallow issues. They can't swallow as well. They feel like something's stuck all the time. Parkinson's patients also start getting some speech, whether they become too quiet or they start slurring their words, because the motor problems in the oral area start occurring. Instead of we see it in the arm or the leg, you might be seeing it there in the mouth and the facial area. And
so is this a fast-moving disease, a slow-moving disease? What would you say?
It's a slow-moving disease. It is a slow-moving disease, and normally. There are cases that it moves pretty fast, but normally it's a slow-moving disease. It has different stages. A mild stage is what we call a stage 1 or 2. A moderate stage is stage 3, and then when you get into a severe stage, you're in stage 4 or 5.
Okay, and what would be standard treatment? You know, they determine, oh yes, we think you got Parkinson's, and we're going to begin a treatment regimen. Am I going to get cured?
You're not going to get cured. What the medication does is it tries to control some of these symptoms. So the medication is usually a combo of levodopa and carbidopa together. And there's different company names for it, but that's usually what the mixture is. The levodopa turns into a dopamine receptor when it gets into the brain, and the carbidopa is what keeps it from turning into dopamine before it gets into the brain. Sometimes once you start on these medications, you get some low blood pressure feelings because of this med change. So that's an important part of controlling your Parkinson's is with the medication. And that's also another reason you need to have a good relationship with your neurologist, is because what they would give you as far as timing that medication, as far as how much of that medication, is not what they would give me. And everyone is different, and you have to find the right dosage, amount, and timing. Timing is very important with Parkinson's medications. So you have to work very closely with your neurologist in order to get that worked out.
So if it's, that's really interesting. I know there's more and more about how different body types and everything metabolize medicine. And so that's, I would guess, what leads to that the timing and everything. So would your doctor probably have you keep a diary or anything like, hey, I took the medicine at this time and I really felt worse or I felt better?
That's right. That's right. The better historian you are when you walk into that neurology office, the better they can treat you.
Okay. Really interesting to me that they're not really treating the disease, right? They're treating the symptoms of it, because I guess there is no treatment for Parkinson's as far as getting rid of the disease.
Right. That's right at this time.
So what's the average age for people? Is there an average age?
Over 60 is when you start, is the normal when you start being diagnosed with it. So that's the normal. Men are diagnosed more than women are. So it's more of a male disease, but I see lots of women with it too.
Okay. And so it's just really kind of frustrating when you got a disease like this and they can't really treat the disease, they treat the symptoms. Do you see some younger people that have it, or is it pretty much just the older people?
It's always been kind of an older person's disease, but more and more in the past few years, we've seen younger and younger people coming up with it.
Okay. And is there any physical therapy or anything that helps when I have this, or is it just all pretty much the meds?
No, it's a combination. You want to work a lot with your physical therapist and your neurologist together, because one of the best things you can do for your brain is exercise. It helps your brain health no matter what, and it's especially important when you have Parkinson's to exercise. So the earlier that you start on a regimented program for physical therapy when you get Parkinson's, the better off you're going to be, because it's easier to maintain what function you have now compared to losing that function and then you bringing me in and we're trying to get it back.
It's interesting. Do you see a correlation between like a person that's, say, 70 years old, they're very active, they're outside, they're going and doing a lot, as opposed to a person maybe that has more stay at home? Do you see a correlation, but maybe that person needs to get out and get moving?
As far as if you're active, you don't get Parkinson's, is that what you're saying?
That's what I'm wondering.
It's not that way. You would think it was that way. Sometimes when more active people do get Parkinson's, it appears more obvious because it decreases their life pretty fast.
Oh, wow.
Their lifestyle pretty fast, compared to people that are kind of sitters at home anyway. Sometimes you don't see it come on as
interesting.
easily. Mm-hmm.
Well, Lisa, I thank you for being here today. I hope we gave some people some pointers on Parkinson's. Any parting advice or anything like to be aware of it with Parkinson's? Or
just the earlier that you see some of these symptoms, the better you're going to be if you start treating them.
Okay, so exercise, and when you think something's going on, be sure and start talking to your medical professional and see if you can get a diagnosis on what's causing it.
Right.
Well, Lisa, thank you for that information. I hope that it's informative for our people watching the show today. Thank you.
Thank you.